Welcome. Thank you for joining us today. I'm Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Before we get started, just want to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you're in listen-only mode. Everyone has music and hear our guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen with time from the end. Only Blum Center staff and our guest speaker will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you of us complete. Your feedback is important to us as we plan future programs. So next, I would like to introduce you all today. We have joining us Dr. Patrice Nicholas. Dr. Nicholas is a distinguished teaching professor emerita and director emerita of the MGH Institute of Health Professions Center for Climate Change, Climate Justice, and Health. She serves as an Yvonne Munn Faculty Scholar at Mass General Hospital. She joins us today to give a talk on the health consequences of wildfire exposure in a climate-changing world. So please join me in welcoming Dr. Nicholas.
Thank you, Amy. I'm delighted to be with you today to discuss the health consequences of wildfire exposure in a climate-changing world. It's important to note that we're hearing a lot about wildfires in the lay press, but there are significant health consequences related to exposure to wildfire smoke. We know that that extreme wildfire events have increased in frequency, and the destruction that they cause has also increased because of the climate change crisis. We know that man-made activities have led to increases in global temperatures. There are changes in vegetation in areas around the United States and around the world, changes in how the landscape grows, and there are also changes in soil that have led to a doubling of incidents of wildfires in the western U.S. since 1984. And I think we all hear about those wildfires in the western U.S. But it's important to note that broadly, the United States and Canada experienced increases in wildfires. In fact, the two worst wildfire seasons in the history of the United States and Canada occurred within the past 3 years, and they burned more than 10 million acres in the West Coast in 2020 and 29 million acres in Canada in 2023. And as a result of these wildfires, there has been large-scale toxic emissions that have occurred, and they've exposed millions of people to harmful air quality, and they have implications particularly for the most vulnerable in society. And one estimate shows that in June of 2023, smoke from the Canadian wildfires placed a third of the U.S. population under air quality alerts. You may all remember that the northeastern United States, Philadelphia, Washington, D.C., had significantly lower air quality and significant risk, particularly for those with pre-existing lung disease, cardiac disease, elders, pregnant people, and pediatric populations. I'm just advancing the slides here, sorry. So in today's discussion, we'll examine what wildfire exposure is and what it means as a health consequence, extreme heat and drought and how they conspire to increase wildfires. We'll have a look at health consequences that occur what these mean for vulnerable populations, and addressing and limiting wildfire exposure. So I'm here on behalf of the Center for Climate Change, Climate Justice, and Health at the MGH Institute of Health Professions. It's a nurse-led, but more broadly, we have multiple health disciplines that contribute to the Center for Climate Change, Climate Justice, and Health. So what is climate justice? It means the relationships among social, racial, and environmental issues and the climate crisis. And it's also the recognition of the disproportionate impacts of climate change on low-income people, those with disabilities, and in particular, wildfire exposure causes significant health consequences for those with disabilities. For Black, Indigenous, and people of color communities around the world, and those persons and populations and environments that are least responsible for the problem. So we know that inequalities drive the climate gap. So we know that housing and land use policies contribute to the significant health consequences of wildfire exposure. So in general, discrimination and those, for example, indigenous populations are disproportionately impacted by wildfire exposure. There are disparities in exposures to fossil fuel-related pollution, and higher pollution levels overall impact BIPOC and other communities. And then there's a climate gap where there are racial and class-based disparities in the effects of extreme heat, precipitation, drought, wildfire, housing loss, sea level rise, and displacement. And all of these lead to unequal health effects. I think it's important to note that the most recent wildfires in California actually impacted some of the wealthier communities, and that's brought more vigilance to wildfire exposure because communities that are not racially and monetary wise unequal are really bringing more attention to wildfire exposure and what it means for all communities. So this is a look at changing climate impacts, and I won't spend a lot of time on this, but it shows changes in climate. And on the left-hand side in the top box are changes in land use and growing seasons. So, for example, extreme weather, precipitation extremes, and changes in land are contributing to wildfire exposure. And then at the bottom, examples of needed research. How can disaster warning systems best save lives? So we know that the wildfire in Hawaii and also on the West Coast, the disaster warning systems need really to have more impact and more attention paid to them to alert people to be able to exit areas where wildfires are increasingly common. And then this is from the Lancet Planetary Health, and you can see at the bottom ecological determinants of health, extreme weather, habitat and biodiversity loss, soil loss, changes in water. So, for example, droughts and global temperature rise all conspire to contribute to wildfires. So, what are the dangers of wildfires? Worldwide, extreme wildfire events have increased in frequency, and their destruction has led to billions of dollars in loss in the United States. There's been a lot of attention to the loss of property related to wildfires, and in particular, the insurance industry is increasingly attentive to the losses that they're experiencing because of wildfires and other extreme events from climate change. We know that anthropogenic activities, which means man-made activities, have led to increased global temperatures, changes in vegetation patterns and landscapes, changes in soil, and a doubling of incidents in wildfires. I already mentioned that the US and Canada experienced the two worst wildfire seasons in their history, and toxic emissions dispersed have exposed millions to harmful air quality, and there are significant implications for example, pregnant persons. And in June of 2023, smoke from the Canadian wildfires had a significant impact on lung health for those in the United States as well as Canada. So, why are wildfires so dangerous? We know that air quality and air pollution, particularly from auto exhaust and emissions from plants, from chemical plants, from plants that produce goods, industrial goods throughout the United States and globally, are particularly dangerous for people. But the chemical composition of wildfire smoke presents a significant risk that to populations, especially those that are more vulnerable due to age. So, for example, infants, children, adolescents, those who are pregnant, those with pre-existing lung disease such as asthma, and those with disabilities who not only may be more likely to experience the toxic effects of wildfire smoke, but also have limited ability to exit areas where wildfire smoke is particularly dangerous. We know that exposure to wildfire smoke during prenatal life can impact birth outcomes and can also have postnatal, in other words, after birth impacts. So, for example, air pollution that includes what's called particulate matter 2.5, and that's exposure to small particles of pollution that are less than 2.5 microns, and heavy metals that can impact fetal life and cross the placenta. Those are associated with abnormal neurological or brain development. So we know that prenatal exposure from air pollution is associated with increases in autism spectrum disorder. And there's increased research around the fact that wildfire exposure also is associated with abnormal brain development. In addition, there are risks to the mother from air pollution as well as wildfire exposure during pregnancy. And this is because of changes in how pregnant people breathe, how much oxygen they need to consume, what their heart output, their cardiac output is. And all of these lead to adverse effects related to exposure to air pollution and also to wildfire smoke exposure. So, Catherine Schwarzenegger Pratt was actually featured asking how she has a podcast, and she was asking Harvard experts about our air quality and the best ways to stay safe. And in the beginning of the podcast, and the link is at the bottom, she actually spoke about the fact that she had to exit her home in the Palisades area because of the dangers of the California wildfires. Some of you may have seen 60 Minutes on last night's program, and they actually focused on the Environmental Protection Agency's cleanup of the Palisades smoke area and wildfire area, and the fact that lithium batteries in electric cars pose an extreme danger. So not only are the toxic materials dangerous, the air quality is dangerous, the toxic materials left behind in the burnt houses and in the soil are dangerous. And then also lithium batteries in the home or in cars have dangers of exploding, similar to explosive devices in war. And the particular 60-minute segment actually focused on the fact that heavy equipment has to remove these batteries from automobiles in a very cautious way. And they have to be immersed in salt water for 3 days and then taken out safely and destroyed with heavy equipment damaging them. And so you can see that the fallout from wildfires is particularly dangerous. In addition, for people whose homes were not destroyed, often those homes are uninhabitable, but insurance companies will not reimburse people for the damage to their homes. So they have smoke and soot and asbestos from older homes and factories that are in their homes that make the homes uninhabitable. This is a very recent look from March this month of the numbers of wildfires in Florida. So even though we think of wildfires in the Western US, they're increasingly prevalent and common throughout the Eastern US and the South related to high heat, low rainfall, and changes in landscape and vegetation. So this is a look at Florida. And even as early as today, I looked at today, and they still have significant wildfire risk. They actually have a drought index that they look at, and if the drought index is higher than 500, then they deem certain communities at high risk of wildfires. This is a look at significant wildland fire potential, and you can see that there are areas from Texas up north to more northern states, and also in Florida, and then traveling north. And you can see that there are areas above normal that are of great concern regarding wildland fire potential. So in the Northeast, we know that Nova Scotia experienced its least active wildfire season of record in 2024, but this followed the most destructive season in its history. So Nova Scotia saw only 83 wildfires, and you can see the number of hectares that were burned, which was a marked drop compared to the 10-year average of 185 fires and over 3,000 hectares burned. And in contrast, 2023 had 220 fires, and it destroyed 200 homes near Halifax. And in Nova Scotia, they credit last year's success to heighten public awareness about safe burning practices, prompt responses from fire departments, and additionally, humid weather and lower winds helped reduce wildfire risks. So, as far as lung health and wildfire exposures, the American Lung Association has a very important site that looks at wildfires, and they note that smoke from wildfires can harm anyone nearby and even many miles downwind. And the site actually focuses specifically on how you can protect yourself, and they they focus on the fact that there are ways that you can protect yourself. However, setting an evacuation plan is particularly important. Determining several different routes you can take in a hurry to leave your area, and thinking about pets or livestock in farm areas. Being sure that you have an emergency kit prepared with supplies such as water, food, a first aid kit, any medications that you need, and a respirator. Having a clean room in your home. If you do not need to evacuate, you still need to be prepared to keep wildfire smoke outside of at least one room of your home. And having a portable air cleaner, keeping that room clean, paying attention to nearby fires. And also, very important is don't count on a dust mask. So, ordinary dust masks filter out large particles, but dust masks and cloth facial coverings do not help. They allow dangerous smaller particles to pass through. So, the Lung Association recommends N95 masks, but those are not helpful and they don't fit children. So it's really important to take precautions for children who are very susceptible to smoke. Staying inside as much as possible with doors, windows, and fireplace dampers shut. Making sure that you don't exercise outside is also particularly important. So pregnancy and wildfire exposure, there's a really important paper in seminars in perinatology for professionals, but we know that wildfire smoke impacts the developing placenta, and black carbon can actually transfer across the placenta and lead to problems with inflammation, endocrine disruption, and damages to the fetus. One of the most important negative outcomes that's really understudied is that preterm birth occurs because of both air pollution exposure, but also significantly because of wildfire smoke exposure. And this is understudied because we know that preterm birth, early birth, can occur for a variety of reasons. So, really teasing out if someone's exposed to wildfire exposure and if someone has air pollution exposure, those need further study because they do lead to early birth. And we know that that can significantly impact the birth of a neonate, a new baby. Fetal growth, there's a significant amount of study about air pollution and fetal growth. Wildfire exposure is less studied, but there is some evidence that birth weight is lower with wildfire exposure, and that makes sense since wildfire exposure can be significantly more toxic even than air pollution exposure. Another area is high blood pressure in pregnancy. So, air pollution is known to increase what's called preeclampsia, which is a condition of high blood pressure during pregnancy, and hypertension in general, high blood pressure in general in pregnancy. And wildfire exposure is another area where high blood pressure can occur and can lead to early birth. And then abnormalities in development of the fetus and abnormalities in the newborn are also being studied because wildfire exposure can have lead, nickel, arsenic, and other toxic chemicals that are known to be um, a problem for fetal growth and for new infants born. And heavy metals are also like arsenic, etc., are also associated with birth defects. So that's important to think about. And then the mental health components of wildfire exposure are incredibly important and socioeconomic inequity. So we know that stress from wildfire exposure, the stress of losing one's home, the concern of losing one's home, the concern of having to evacuate, all of those can lead to trauma during pregnancy and after pregnancy. And stress is known to um, increase the risks of early birth and problems after birth. So another significant area for negative aspects of health. This is a very busy slide looking at air pollution in general. And for health professionals, I think this is particularly helpful. Um, Poor air quality from fossil fuels, but also wildfire exposure can lead to significant negative health outcomes for pregnant women. And some of these are in-depth described, but others are particularly important for everyone to think about. On the right-hand side of the screen, the patient encounter, it's important to educate vulnerable patients, those in urban and low-income areas about health risks, supporting patients with underlying lung diseases, to have air filters at home, educating people about monitoring local air quality, particularly if wildfires are in the area, or in the case of the Nova Scotia wildfires, the entire East Coast was at risk, and having educational materials available for pregnant women, those with disabilities, and others. So one important thing to think about, my granddaughter was pregnant, or my daughter-in-law was pregnant during the Nova Scotia wildfires, and the air quality in the Northeast was poor. And I urged her to wear a mask during that time. But I didn't even realize the importance of an N95 mask. She wore a regular hospital mask because she works in a hospital. But educating people, particularly those who are pregnant, those with disabilities, children, adolescents, are important around exposure to wildfire smoke and air pollution in general. So those with disabilities, so people, decision makers may not fully consider people with disabilities, and they've been understudied as far as the impact of wildfires, and that needs more study. They emergency warnings and other important messages may not be designed with accessibility in mind. Often people are told to get in their cars and exit, not to take almost nothing with them if the wildfire is imminent. Those with low vision or blindness, hearing loss, mobility, all have increased risks. And they also may need ongoing medical care, which may be disrupted during a natural disaster or an extreme weather event like a wildfire. And people with disabilities are more likely to have social and economic risk factors, poverty, unemployment, that also put them at greater risk during the wildfire exposure and then in the recovery period. So, for people with disabilities, and this is from the Environmental Protection Agency, fire, heat exposure, smoke inhalation, chemical exposure, all of those are significant risks for those with disabilities, particularly those with lung illnesses. They can have an increased incidence of injuries and death. We know that populations at risk, children, pregnant individuals, elders, those with chronic illnesses, and people who've already had occupational exposures are more likely to be at risk. And then there's the issue of lung cancer. There was a very good paper about those who have lung cancer and air quality, poor air quality, and air quality exposure, particularly wildfire exposure. So, for example, firefighters are at significant risk of lung cancer. And also in wildfires, you may have read that on the West Coast, there's a significant loss of firefighters related to the ever increasing risk of wildfires. And they're a population that have unique occupational hazards, such as smoke inhalation and asbestos exposure. And smoke is a significant contributor more broadly to air pollution that already exists. And it has a different mixture of particles in the air and also gas pollutants. And we know that prolonged exposure can make lung diseases worse, including asthma and chronic obstructive pulmonary disease. One study actually found that there was a nearly 20% increase in emergency department visits and hospitalizations for people with disabilities. So those with cardiovascular diseases, that it's been found that exposure to wildfire smoke increases cardiovascular related issues. So people are more likely to have a heart attack, that is an acute myocardial infarction. They may have sudden cardiac death, like increases in cardiovascular mortality. There are more emergency department visits for cardiac issues and more hospitalizations, and heart cardiac arrest or heart stopping and heart failure are also increased related to exposure to wildfire smoke. In elderly populations, we know that the proportion of older people living in places with more wildfire risk is higher than the population at large. And in rural areas with the greatest wildfire risk, 35% of people are over the age of 60, so they're already at greater risk because of age. And the number of older people exposed to wildfire risk is expected to increase as populations grow older and as wildfires increase in frequency and intensity. And this is a look from the Boston area. So this is smoke exposure from a building fire in Roxbury within the past month. And more than 150 firefighters battled an 8-alarm fire. Now, this was not a wildfire. However, it was a fire that occurred in an area that is by the Southeast Expressway 93 South and North that already has very high exposure to air pollution. So the convergence of the fire and the air pollution from the highway, the roadway, led to very poor air quality in the area. And it's also an area where there are a lot of socioeconomic disparities. And people were urged on the news and on public service announcements to keep their doors and windows closed, to keep the smoke out, and to avoid the area. So for those with disabilities, the first thing is to think about creating a support network. So staying connected to your local community before, during, and after the extreme weather event. So during the wildfire isn't the only time. As I mentioned, the Environmental Protection Agency is clearing out the area where the Palisades and Altadena fires were. And that area is significantly risky for, those with disabilities and healthy people as well, because the residue from the wildfire is toxic residue on the ground. In 28 days, the Environmental Protection Agency cleaned up a significant area, but many of the people who did reside there were concerned about where it was discarded, what was left behind, and is there toxic residue that's going to impact their health. This is also especially true with the Lahaina wildfires there that occurred in Hawaii, and the concerns about the residue from the wildfires and the toxic air quality and residue there. Preparing for an emergency, having an emergency plan ready, and a kit with medication, food, water, first aid supplies. Also having copies of your medical records, particularly for those with disabilities. Getting help locally, for example, emergency management offices may have disability registries and can assist, but they may not be reachable during an emergency. In addition, people often use cell phones. They may have their cell phones without batteries and loss of power. And the importance of coordinating transportation before you need to evacuate is really important. And then being informed about air quality, so using Air Now, which helps check local air pollution levels. And I mentioned the drought index, which they measure in Florida, and anything over 500, they know they have to be concerned about wildfires because of high ambient heat, high heat in the areas, and then being able to check in with friends and family. And if people live in assisted living facilities or long-term facilities, they may in fact need assistance, and having people move from the area and evacuate is important. So this is a slide that was from the PBS NewsHour, and it actually talked about high ambient heat, high heat, and how schools that do not have air conditioning really have significantly lower standardized scores because of children's exposure to high heat. But in addition, poor air quality and the convergence of poor air quality and high heat also lead to significantly lower standardized scores. And wildfire exposure, as I mentioned, the Nova Scotia fires, the air quality significantly lessened air quality in the DC area was profoundly impacted. Philadelphia, the Northeast United States, yet children were still going to school and impacted by that air quality, which was not well measured during those significant fires. Um, for climate change strategies, we look at mitigation, which is reducing and stabilizing heat trapping greenhouse gases, but it also means mitigating exposure to wildfire smoke and thinking about how do we reduce the likelihood of wildfires and the subsequent poor air quality, and not to mention the dangers of imminent fire and loss of life from the fire itself. Adaptation, which means reducing vulnerability to the existing impacts of climate change, such as wildfires, and having a clean air room or evacuating from the area is an example of adaptation. And then resilience is being able to absorb and recover from, as is currently happening after the Palisades and Altadena fires. But how cleanup is done, for example, how the Environmental Protection Agency cleans up, how the insurance industry, excuse me, supports people in either rebuilding homes or cleanup of homes that are impacted. All of these are important. And then air quality impacts related to wildfire exposure. So there can be acute exacerbation, in other words, an acute result from exposure to wildfire um, from somebody who already has lung disease. So somebody who may have severe allergies, somebody who has asthma, somebody who has lung cancer, they may all have a significant acute response because of wildfire exposure. And then there's also those who may have a new onset of respiratory illnesses. So it is increasingly being studied that those who have wildfire exposure may have new occurrences of lung illnesses because of what they've inhaled. Inhalation injuries, so as a direct result of extreme exposure to wildfire smoke, people can have significant lung problems. Those with lung cancer can become sicker and can actually have um, uh, an increase in symptoms from their lung cancer. I talked about those who are pregnant and the issues around early labor. There can also be stillbirth with poor air quality, low birth weight, and also cardiac issues. And then premature death. I mentioned the increase in hospital visits. And there can also be lost work and school days. And in addition, there can be neurological or brain issues and vascular issues. So, for example, strokes can increasingly occur because of exposure to poor air quality and wildfire smoke. So, how to minimize wildfire exposure? A lot of these are very specific, and the most important is to think about evacuating the area. But if you're still exposed, so for example, in the Northeast United States, we were thousands of miles from the Nova Scotia wildfires, but still the air quality was poorer. So what should you think about doing? Keeping your windows and doors closed, using fans and air conditioning to stay cool and to avoid smoke exposure. If you can't stay cool, seek shelter elsewhere and learn more about how to protect yourself from smoke and extreme heat. And it's important to reduce the smoke that enters your home. So if you have uh, um, an air ventilation system with the fresh air intake, set the system to recirculate or close the outdoor intake damper. If you have a window air conditioner, close the outdoor air damper. And if you cannot do that, you shouldn't use the air conditioner. And it's important to make sure that the seal between the air conditioner and the window is as tight as possible. And if you have a portable air conditioner with a single hose vented out of a window, you should use that sparingly um, in these conditions, and because the smoke can be brought inside. If you have two hoses, you can make sure the seal between the window vent kit and the window is as tight as possible. And then the next is to use a portable air cleaner or a high efficiency filter to remove the fine particles from the air. If you use a portable air cleaner, place it where people spend the most time and run it as often as possible at a high speed. And if you don't have a portable air cleaner, you can use an air cleaner that has an attached air filter to the fan as an alternative. If you have an air ventilation system with a high efficiency filter, you should run the fan as often as possible by setting the fan on rather than auto, so that the air particles will be filtered. And then check the filter on your air filter fan or your system frequently and change the filters when they appear dirty. Um, More on minimizing exposure, avoid activities that create more fine particles indoors. So not smoking and vaping, and avoiding using gas, propane, or wood burning stoves and furnaces. Avoid spraying aerosol. Avoid frying or broiling foods. Avoid candles or incense. And avoid vacuuming unless there's a HEPA filter. Another thing is to avoid strenuous activity during smoky times, because that will lead to you inhaling more smoke. And creating a clean room, and there's a video on the slides that shows you how to set up a clean room. And then having a supply of N95 respirators. As I mentioned, I didn't even realize during the Nova Scotia fires that a hospital type of mask is not helpful with wildfire smoke. And then when the air quality improves, air out your home by opening windows or the fresh air intake on your HVAC system, and run the exhaust fans in the kitchen and bathrooms. And then, as I mentioned, the cleanup after wildfires is extremely dangerous. The 60 minutes program last night was incredibly educational. I did not realize the dangers of lithium batteries, and the emergency workers had to remain back 75 feet when the heavy equipment was removing lithium batteries from electric vehicles. The vehicles had to be turned upside down by the heavy equipment, the batteries removed, and as I mentioned, they had to be immersed in salt water. So those represent an extreme danger for people during a wildfire. If they're at home and they have an auto in the garage, for example, it can become an explosive device. So resources to limit wildfire exposure. These are resources that you can access, and the resources are listed on the left, and then the description of them is on the right, so you can learn about actions to reduce smoke exposure from Air Now wildfires, reducing indoor smoke exposure, and keeping air quality as optimal as possible. Creating a clean room is there. Reading about air cleaners and air filters in the home, and then air quality guidance for schools, and then wildfires and indoor air quality in schools and commercial buildings are also listed. And then here are some selected resources from both nursing and other healthcare related organizations. And then reference specific to this population. I mentioned the American Lung Association has a whole site on wildfires. The article by Basilio and Zlotnick talks about impacts on pregnancy from wildfires. And then the third one is climate change and women's health in the United States, and has specific areas related to poor air quality and impacts in pregnancy, and also heat exposure during pregnancy. We know that wildfires also are associated with high heat as well as extremely poor air quality. and then wildfire smoke exposure and cardiovascular disease, and then aging and wildfire risk to communities is the final one. And then these are resources from the MGH Institute Center for Climate Change, Climate Justice, and Health, and more resources. And then I would welcome any questions.
Thank you, Dr. Nicholas. We are now at the end of this session. If you have any questions for Dr. Nicholas, feel free to enter them in the chat. You had addressed this question earlier or throughout the presentation. Do you have anything else you'd like to include about masks and effectiveness against the smoke from wildfires?
Yes, thank you for that question, Amy and audience. N95 masks are the only way really to eliminate the small particles that are in wildfire smoke. And so, for example, with air pollution related to auto traffic, for example, wearing a hospital type of mask is appropriate. But wildfire smoke has toxins and tiny, tiny particles, toxins, so toxic materials that are so dangerous that really only an N95 is helpful. And that's something that's not at all well understood by the general population. So I'm glad that question came up, Amy. And as I mentioned, as a health professional and someone who is embedded in the climate change literature, that's new information for me. N95 masks are not always readily available. I mentioned people don't know about them. They're not easily purchased, maybe online more so. And children cannot easily wear them because they don't fit well, and they're more at risk, as are adolescents. So the importance of a well-fitted N95 mask is really important.
And when you say well-fitted, what things should they be looking for when fitting an N95 mask on themselves?
So in the hospital, people can check for a really good fit with an N95. If you're at home and you're exposed, for example, to a Canadian wildfire and you live in Maine or Massachusetts and the smoke is migrating south, making sure that you ask somebody else, does it seem that this is very tight fitting around my mouth and nose, is the best way to approach that.
Thank you. And how does climate change, air pollution worsen respiratory and cardiovascular diseases?
That's a great question also. So the toxins from the wildfire smoke cause people who already have lessened lung capacity, the lessened lung capacity. So for example, the very small alveoli, which are the little sacs in the lung that allow oxygen to cross over into the bloodstream, those are already diminished. And the smoke actually crosses over and limits oxygen's ability to cross and get the oxygen into the bloodstream. With cardiac disease, the lungs don't work as well, and then the heart can't pump as well because it's not getting oxygenated blood.
Thank you. We have a question if there's a way to see how the air quality is in one's area. Was that one of the resources that you shared earlier?
Yes, you can check the air quality, and it's on one of the slides that I just showed, which said resources. So you can check air quality in your area. So for example, I didn't do it because I really didn't think the risk was that high during the Nova Scotia wildfires, but I really went on the alert when I saw photos of how poor the air was in Washington, D.C. It was orange color from the smoke, and in Philadelphia, very, very diminished. It actually seemed almost less so in the Boston area than those areas, which could have been just the migration of the smoke going south. But yes, you can check air quality now.
Is it airnow.gov?
Yes.
Okay. So
Mhm.
as you were presenting, I shared a bunch of resources in the chat. I didn't get to share links on from the last two slides. So if anyone's interested in the list of those resources, feel free to email the Blum Center at pflc@partners.org, and I'd be happy to share that with you. Some question, is air pollution impacting food nutrition in any way? Is there any way we can prevent this?
That's also a great question. There's a scientist at the Harvard T.H. Chan School of Public Health who focuses heavily on the changes in nutrition value because of air pollution, more broadly, climate change and high ambient heat. And there are changes in food and nutrition related to poor air quality and high ambient heat. So, for example, in some of the poorer countries of the world, there the foods are that have protein have less protein in them. There's less iron. There's definitely less nutrition value in foods that are being grown. And as a result, there's more of an impact on malnutrition, particularly in the poorer countries of the world. And also, pregnant women who have to have certain nutrients and vitamins during pregnancy in countries where they can't augment natural vitamins and minerals and proteins in food. We can get vitamins in our country and other industrialized countries. But in poorer countries, the fact that nutrition is impacted by climate change is affecting women and children, pregnancy, etc.
Yeah. We have a question regarding the portable air cleaners. Is that the same as an air purifier? If so, what should one be looking for when choosing one?
So an air purifier is very helpful and effective added to an HVAC or an air conditioning system. And I don't know the specifics of what type of model or make to use, but I do know that any air purifier added to an HVAC or air conditioning system will be helpful in eliminating the smoke and the toxins associated with wildfires.
Thank you. For any healthcare providers joining us, what support can we offer individuals affected by wildfires?
I would start with the fact that making patients aware is critically important. I know from my own family experience that um, providers don't know necessarily to share with pregnant individuals that they need to be extremely cautious in avoiding wildfire smoke exposure. We also know that just air pollution exposure is dangerous for pregnant individuals. So, just starting with educating providers about limiting their exposure is incredibly important. And because that's why it's important to educate providers, because a lot of us don't know a lot about these uh, climate change related health challenges that people face. So certainly starting with provider exposure, but also providing patient education. And this is a great audience for this, Amy, because patients can then go to their provider and say, I understand there's a wildfire in Nova Scotia. I have severe asthma. Can you please give me some advice about how I should approach this upcoming respiratory challenge?
Thank you. And what are some small acts that we can do to prevent air pollution and protect the environment?
The first one is to drive less. The second one is to carpool. The third is public transportation, because auto emissions are probably among the most significant that contribute to um, poor air quality. That's very, very significant. But then regarding wildfire exposure, being extremely cautious about any burning, if it's even allowed in one's community. And then cutting back brush. So, for example, we do know that wildfires in Nova Scotia and the West, in Canada in general, and Western US, also are related to poor management of dried brush that occur. In Florida, for example, there are large swaths of land where there's a lot of dried brush. They're not getting enough moisture from rainfall. And then they have high heat, and all of those converge to lead to an increase in wildfires. So better land management policies, which go beyond individual people. It's really governmental, statewide, federal land management are important.
Thank you. I don't see any additional questions in the chat. Before we end today's session, do you have any final thoughts you'd like to share with the audience?
I'd like to thank you very much for your interest. This has been terrific. It's, as I mentioned, I keep myself abreast of the climate change literature, and I very much didn't understand the significance of wildfire exposure, and particularly not until the Nova Scotia wildfires did I even have an emerging interest in the area.
Thank you. Oh, we have some thank yous in the chat. And for everyone joining us, thank you so much. As I had mentioned, today's session is being recorded. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone.
Thank you, Amy.
Thank you. Take care.